Welcome to TCNtalks, an Anatomy of Leadership. We continue our Part 2 conversation, AI, Hospice Fraud Crackdown, and Medicare's Future, the biggest healthcare stories of 2026. And now, here's our host, Comeaux and Cordt Kassner.
So I don't know if you'd agree with that, Cordt, but the moratorium is pretty fascinating. So breaking on May 13th, breaking news, CMS announces aggressive nationwide crackdown on fraud with 6-month hospice and home health agency enrollment moratoria. So, it's kind of fascinating. We taped the podcast with Kim Brandt, who's the Chief Operating Officer of CMS. And usually we'll tape it just like you and I are taping this. It's going to air the first week of July. We're taping this one about a week before. Usually they're about a month before. I think in that case with Kim, it was about a month before. So we did not know our podcast with her was going to air the day that Kim Brandt is standing next to Vice President J.D. Vance. And I actually emailed Kim and said, well, how cool is this? She goes, we planned it this way. I'm like, well, cool. I wish you would kind of give me a little. She did say in that podcast, like, hey, there's going to be some really interesting news coming out. I thought it was what was happening in California at the time, just as far as their fraud crackdown, but the moratorium. So that was a huge announcement. Never happened in my history of 30 years within hospice. It's happened in other places, home health, et cetera. Cordt, I'm curious your thoughts on this. And do you think it's going to be just 6 months?
Not a chance. I think this moratorium is going to be extended. I don't know for how long this kind of review or pause period will last. But when I look back, I think it really took us about 3 years to get into this fraudulent mess. Like that, in some ways, 3 years is overnight, but it wasn't overnight. It wasn't in a week or a month or a year. It took about 3 years to really get that ball rolling and to figure out what was going on. And I think it'll take about 3 years to get out of it. So the moratorium, this focus on hospice fraud is going to be around for a couple more years. And then I suspect we'll move on from it.
And it's going to be interesting because then you go back to my prediction in first segment about, I think there's some broader healthcare stuff that's going to come to a head. So there's going to be I hope I'm right on this one. It's going to be interesting to see when you and I get to the end of the year. But I think because of that, like healthcare at the front and center, like one of the biggest national policy challenges to our country. And then that's kind of baked into that. That always makes me a little nervous. Like you just don't know then which way that's going to cut. Like what's the interpretation? Well, one reason why healthcare is screwed up is because of hospice. No. It is because some people that are total outliers, they're not even playing the same game that we're actually playing. I can't remember how it came up in the conversation with Kim Brandt, but there's an NBA player that apparently was a horrible player. But he was betting kind of almost like shorting the game, was basically throwing the game. And so and then you got someone like LeBron James. I grew up with Michael Jordan, Larry Bird, or Magic Johnson. I mean, guys who are just like incredible, trying to be, world-class athletes, top of the game. That dude that's trying to throw the game ain't even playing the same game. Well, that's the analogy of some of these horrible, fraudulent hospices. They're not playing the same game compared to the vast majority of people trying to do the right thing. So that is the one thing that makes me nervous that I still remember years ago, I think his name was Mike Bell. He was at Hospice of Florida Suncoast when the Terry Schiavo situation occurred. He had this great presentation. He said, I used to dream of days that CNN would be on our front porch wanting to talk about, like that is not the one. Yeah, not this one. Exactly. And I feel a little bit that this whole thing around the fraud.
I get phone calls and emails from the general public through the National Hospice Locator, people trying to find a hospice regularly, several a week. And in the last 2 weeks, I've had 3 phone calls from people who say, I'm calling this hospice. Nobody's picking up the phone. They say my brother is on hospice, but he isn't. I'm like, can I ask where you're calling from? Southern California. I just stop. Like typically, let's look up your location. Let's look at quality scores. Let's talk about, call 3 hospices in your area and determine which one will be. I just stop. I'm like, let me give you the name Sheila Clark at the California Hospice and Palliative Care Association, because she is doing a She is the Michael Jordan of hospice fraud in California. She is fighting the good fight. What you're describing sounds like a fraudulent provider. She can help sort that out and figure out what to do if it is fraudulent and what to do if it isn't fraudulent. But let's just stop this conversation right now. Here's her phone number, and I wish you well. And I tell people, it hurts my heart to have this conversation with you, because most of the time people are struggling with a dying loved one.
Yeah.
Finding a good hospice should not be the hard part. And it is in some parts of the country.
Well, let me land the plane because I want to get to yours. And so now moving into my June, there's just two I want to point out because, again, the moratorium took a whole bunch even into June, but only two that I haven't picked on yet. There's a New England Journal of Medicine rigorous assessment of leadership development programs in healthcare. And just talking about that, the time we're going into, leadership programs are a place that people, well, we just need to cut that, but it's actually not what you should cut. And, it is, we do a lot of leadership training. Our leadership immersion course gets world-class, literally just reviews. And so just caution people as we go into maybe challenging times. This New England Journal of Medicine really was good, well-researched. Last article, I'm going to hand it to you, Cordt. Medicare's Part A trust fund is projected to run short in 2033. And so this was in Saving Advice. But, it does worry me that even with my prediction of the healthcare challenge, we also then have this kind of bridge out in 2033. But I think you have a slightly different take on that when you and I were kind of prepping each other what we're going to talk about. And so I've always thought 2030, 2033 a very interesting time, that it really is the first time that the trust fund really will be upside down. Do you have a different opinion about that?
I do. And really it's formed from one of my early meetings with Kim Newman at MedPAC, who I think is amazing. I think she does a great job and really appreciate the work that MedPAC does as an overview of the entire Medicare benefit. But I walked in, I was giving this presentation to her and the MedPAC team about, if we don't increase hospice reimbursement, 32% of hospices are going to close in the next 7 years. And, I thought I had all this, compelling data and an argument and, descriptions. And she just kind of looked at me and she said, Cordt, we don't think about hospice in 7 years. We go year to year and things get funded year to year. That's why MedPAC looks at things year to year, not these far out projections of what might happen. And I've been in hospice over 25 years. And I think at the very beginning, the Medicare Trust Fund was projected to last about 7 years. And that's because I think Congress kind of funds it for 7 years. And so I really don't get too excited about that particular projection because it gets funded year to year. And if there's a crisis and we need more, guess what? It gets more. If there's a crisis and it needs less, it gets funded less. But that 7-year mark seems to be, in my opinion, a comfort zone that's about where they keep it.
Interesting. Well, kind of counterpoint, but at the end of the day, we'll punt it because this will become more important for you and I in future years of the conversation. The one difference, though, is the demographics. Demographics is destiny. And so my generation, the Generation X, compared to the actual baby boomer, so the number of people paying into the system, the people are paying out, that is an interesting math variable that we've not dealt with before. Now, the millennials are a huge segment of the population, and now we've got Gen Alpha, Gen Y. They're actually coming in, which we have a podcast dropping actually the week before you and I air this one, talking about some of that. So, yeah, we could, that'll get more interesting in future years. We don't need to burn time today on that. So now I want to hand it to you for your articles.
Yeah, well, thank you. Well, so we've been covering stories from late March to late June on this podcast. During that time frame, Hospice and Palliative Care Today covered 741 articles that collectively garnered nearly 340,000 reads or click-throughs, a number that remains consistent with prior quarters. One of the metrics I track is how many articles surpassed 1,000 clicks each, because that's a pretty good marker that a lot of people were looking at this story. And in this quarter, we had 100 stories that surpassed 1,000 clicks each. So we thought that was really cool. You mentioned earlier, and I want to spotlight this at the beginning of my comments, that Dr. Joy Berger, our editor-in-chief, has been working on a 25-part series to celebrate the 250-year anniversary of the United States. She calls this a history of care, 250 years of need, service, and hope. And each day for 25 days prior to July 4th, Dr. Berger's been highlighting the challenges and successes from each decade with particular applications for hospice and palliative care woven throughout. It's really a timely reminder of our roots and an enduring call to innovate with compassion. What's coming, just to give a heads up, which is probably when this podcast will be released, is she's going to pull together all 25 days into a short booklet and make those PDFs available to read, to look at. She's hoping to pull together presentations and really be able to discuss the history of America and within the context of healthcare and hospice.
Yeah, so just kudos to you guys. I hope you need to apply for some kind of award for that, because I think it's award-winning that you guys have done that. And what a great way to honor 250th birthday of our country. And I look forward to it. I'm a history geek. And I think that, while history doesn't repeat itself, it does rhyme. And I've already noticed some things like, that's so fascinating. I didn't know that actually was that decade. I think it's interesting to look back, and because it does inform maybe where we need to be going in the future. So kudos to you guys for doing it.
Thank you. Yeah, she's done a fantastic job with that. We've received some really positive feedback. So getting into IRA's framework, beginning with zero tolerance for waste, fraud, and abuse, this quarter we published about 40 fraud articles. And that's, as you said in your comments, Chris, that's a lot. It makes the regulatory piece really an important part of the discussion in 2026. Our most read story of the quarter was one of those articles. It was the Ways and Means, Approved Policies, Fighting Fraud in Critical Safety Net Programs. And this one had about 9,000 clicks. And while this was a general, like we need to fight fraud article, there was a specific segment of it, Protecting Seniors and Stopping Fraudulent Act, that really caught our readers' attention. Getting into IRA's 4 calls for action, clinical and programmatic standards. One of our most read articles this year or this quarter was Alzheimer's Disease Facts and Figures. Their annual report came out, and it was our top clinical story this quarter. Alzheimer's and related dementias remain high engagement topics, reflecting the growing intersection with hospice needs. The report notes Alzheimer's affects over 7.4 million Americans aged 65 plus, with cases projected to nearly double by 2060, which is a long way away. But the piece that I'll add into this is I'm involved in a few research projects right now looking at Alzheimer's disease and related dementias. Sometimes that's focused in the nursing home setting, but this is just becoming a growing segment of hospice care.
Yeah, we had done some podcasts on Alzheimer's last year actually, and then prior year actually. But I think in 27 we need to probably, maybe we could actually bring some people on the show to talk specifically about the guide model. Interestingly, the guide was just actually extended to 8 total years, which I think is a good sign. And I think it's also related to this. I mean, it is probably going to become the leading cause of disease death in the United States. And the thing that makes me concerned kind of / nervous is I'm not sure, like I love the hospice model. I'll talk about that a little bit later. Alzheimer's is different. And it was Joan Tino, I can't remember. Yeah, it was my first podcast with her. And she said that, it's a death by inches. And that makes it different than a lot of other diseases that we deal with. So I don't know what the best model is specifically for that. And when you look at some of the outlier stuff that is considered fraud, when people are where the audits get focused, is some of these long length of stay patients. Quite often it is usually in some type of Alzheimer's dementia. And I think it's hard. It's hard I know we have Fast 7 and different ways to say, well, this patient is now appropriate. But that death by inches does make it a little bit different.
It does. And I think we need to figure out appropriate clinical care for these folks, but also from the reimbursement model perspective, what makes sense and what's
Yep.
possible. The other clinical issue, of course, we had Veterans Day this quarter, and Joy pulled together a compilation of several articles from hospices in how they were honoring their veterans, which I thought was really cool. And that was also among our most read stories. Ira's second category, making meaningful data readily available. The one that I want to highlight here, the one article I want to highlight here is the Ascent Consortium to publish 2 requests for applications. And the Ascent Consortium, of course, led by Gene Kuttner, Melissa Aldridge, Ab Brody, Chris Gutner, and Kimberly Johnson, an NIH-funded consortium to advance hospice and palliative care research. They're doing great work, and I just want to. This article was highlighting 10 recipients of some of these RFPs that they're putting out. So congratulations to them. Of course, we can't talk about making meaningful data readily available without talking about the Pepper reports have come back. They were in place. They took a hiatus during COVID. Now they're back, and so hospices are figuring out, what does that mean? What are their scores? So we certainly want to encourage people to be participating and aware of their Pepper reports, because that's going to be an important publicly available data piece.
Right, just one comment too, Cordt. We did a podcast with Gene on, because this whole Ascent consortium just feels like a pivotal moment, because it's a lot of, I feel like I grew up at Four Seasons, Dr. Janet Bull, Dr. John Morris, kind of grandfather, grandmother of palliative care. So many incredible luminaries, Amy Abernathy and others. It feels like Gene is like carrying that torch into the next generation with amazing NIH funding and the fact that they got this grant and what they're going to do with it. And so that'll be one we definitely want to watch. And I know you're a huge Gene fan. I am as well.
I am, absolutely. She's amazing. Ira's third point, driving competition based on quality. I really appreciated NPHI's call for a thoughtful hospice payment form reform, which came out in June, which rewards high quality care. NPHI explores lowering the aggregate cap to deter bad actors, reallocating payments to better support providers caring for the sickest patients, and modernizing the benefit while questioning certain GAO recommendations. They emphasize aligning incentives with patient needs over volume, and this could foster genuine competition and innovation.
I love the article as well, and just also support this approach. It's something that I learned from them, because you cited earlier the fraud bill. That was one of the most clicked on ones. The one to watch that could actually change reimbursement is the CARES Act. And so Blumenauer, who retired, who did the first version of the CARES Act, and I remember going, well, he's retiring, and because of what was going on at the time, that's not going to be passed. What I now realize is, his history, this becomes a vehicle, and that vehicle could morph and change, but it is a kind of the way, remember as a kid, I'm just a bill sitting on Capitol Hill. Well, how that whole kind of process would work is that vehicle can morph, but the fact that that vehicle was created is like part of his legacy. So I'd never thought about that. I now understand that the CARES Act is the vehicle to watch. So there are comments that eventually could get baked into the CARES Act as something that we do need to watch then, and totally support lowering the cap. Some other interesting things I think you could do with how the reimbursement is actually shaped. And then, what about upstream? We didn't get to it. One of the ones that I was going to cite was an article about palliative care. There's some interesting codes that Dr. Jake Quinton at CMS is actually looking at that have been there for a long time that have no reimbursement related to them in palliative care. If that gets funded and some of these other things that NPHI is thinking about, it creates a really interesting then way to modernize the benefit, carrying it into the future without totally throwing the baby out with the bathwater in terms of what is this beautiful benefit that has been hospice, where millions upon millions of people have benefited. And we know that it actually has saved money, even despite the icky stuff with the fraud, et cetera.
Well, and I think the nudge here is really for all of our listeners to be thinking about how they can participate in policy and advocacy work, because who better to inform the development of hospice policy than hospice professionals? And often we think that's kind of outside of our scope, but it's so important to be at that table.
Maybe one comment to that too, Cordt. I had a huge aha. I don't know if you went to the gala at MPHI's annual summit. They honored Jay Mahoney, which was pretty cool. I grew up right during the time when Jay was switching over to Don Shoemaker to be the head of what later became NHPCO, now the Alliance. And one of the things that struck me listening to Jay tell that story about the benefit coming to fruition, it was nothing short of a miracle. To actually think of how you had Republicans and Democrats, and then just the incredible advocacy and the right people, the right place at the right time to get this benefit, it was an absolute miracle, which then makes me concerned about, like, if we want something to happen, it ain't just going to happen. We've stood upon the shoulders of incredible giants before. That's why I love us highlighting Dr. Bayat, because I feel like he's that bridge between, hey, I was there in the beginning and I'm concerned about where this thing is going, which is why his framework is so important. So I just want to highlight what you just said, because we do have to be at that table, because it took a miracle the first time. And if we just sit back, and if the fraud becomes the narrative of what this industry is about, we will have failed miserably. And they will look back and go, what did you guys do when you were there in 2026? We know what they did in 1983 when it became a benefit.
Yeah, it was great. I had a chance to talk with Jay in the hallway before the gala and meet some of his family that were there to honor him. What a rock star.
Yeah, incredible.
Ira's final point is embracing and promoting our authentic brand. And one article that jumped out to me and to many of our readers was a special report, Untapped Potential, the Power of Peer Support Programs in Prisons. And we've talked about hospice in corrections before, and it's just a recurring theme that I like to poke on, because I really do think it's so important. What a vulnerable population, and an opportunity for hospice and palliative care and the hospice philosophy of care to really integrate within corrections. I want to give a special shout out to Matt Hansen, CEO of the Home Care and Hospice Association of Colorado and of the Home Care and Hospice Association of Utah. He has begun coordinating state hospice leaders with departments of corrections leaders to advance hospice programs across the country. It's in the early stages, but kudos to him. He's doing a great job pulling together these diverse groups of folks.
Very cool. Maybe that could be a future show or something. Keep that in the back of your mind.
That would be great. I'd be real interested in that. The last category is just sort of my favorite. We have Chris's category, we have Cord's category, and today mine, and with all conflicts of interest. These aren't potential, these are real conflicts of interest. We announced the strategic combination of 1520 AI and Hospice Analytics, my research company. And we're so excited to be advancing data-driven hospice care with AI innovation. It's an exciting evolution. We're combining these organizations, and it's focusing on practical, responsible, hospice-specific analytics and AI for compliance and quality and outcomes. What an exciting time to bring together a team of incredible folks. So we just announced that at the end of April, and we're unfolding what that looks like this year with more to come. So keep your ears open for that.
Maybe to ask a couple questions on that, Cordt. Congratulations, first off. And so we had Ernesto on a podcast earlier this year to talk about AI. He did mention 1520, but the point is he's an expert, a guy who grew up in hospice as a CEO, but then later got a degree in actual artificial intelligence. And so maybe people might want what changes and maybe what's not going to change as we go forward.
There really is an interesting opportunity. And at this point, from a hospice analytics perspective, it has been, 90% run it the same way you always have been, keep doing great work and helping hospice leaders understand the information and apply it and make, increase access to high quality hospice care. That's really the goal there. The other 10% that is changing and has already begun to change are the AI integrations. How can we use AI to allow a user to ask a question and say, Cordt, you work with 85 billion Medicare claims. What can be, what would they say about this question? And so we're beginning those kinds of integrations, both with the claims, the cost reports, care compare information, but also with the National Hospice Locator to help people find hospices uniquely, personally tailored to their needs, which is really an exciting development. So we're beginning to put those pieces in place and plan to roll them out later this year and next year both.
I didn't tell you I was going to ask you this, but you get to play in that sandbox that is Hospice Analytics, and the sandbox we play together on this podcast is Hospice and Palliative Care Today. Any spillover to Hospice and Palliative Care Today with that partnership?
At this point, like today, the Hospice and Palliative Care Today is a bright line, separate company, separate thing. That Joy and I run with very much appreciative of our sponsors, Telios and others, and that's a separate company. We're talking like maybe it makes sense to fold it under 1520 AI or some of the other umbrellas associated with that. It's just a conversation that hasn't come to fruition yet.
Gotcha. Well, cool. The thing that occurs to me, so to our listeners, what a quarter and what a first half of the year.
Absolutely.
Because when this airs, we'll have half of 2026 under our belt, which is kind of crazy. The other thing that occurs to me, though, Cordt, just the privilege to do this together. Like, I work my tail off and you work your tail off in Joy. We do this for really all of our listeners, trying to stay on top of what's going on in this field and in this industry, so that way they can do their jobs better. And it's just hitting me of how fun this is, the privilege that it is, the responsibility it is, and then to pay it forward to our listeners. And so I just want to give you kudos, give Joy kudos. Love that we keep doing this to serve our listeners. And man, it's going to be interesting to see what July, August, September, and then our last quarter of this year. I think the second half of the year is going to be even more fascinating than the first half.
It's a great opportunity. Thanks for allowing us to participate with you, Chris. You're doing a great job with these.
Yeah. And to our listeners, we want to thank you. Make sure you hit that subscribe button, pay it forward to your coworkers. It's always interesting. You could be frustrated by the challenges you see in the world. Let's be the change that we wish to see in the world. And as we always do, we want to leave you with this brain bookmark. The idea is like a thought prod or a brain tattoo. It's always fun to kind of do these, and we append them post-show. And so thank you for listening to our podcast. Thanks for being an actual listener. Cordt, thank you for you and Joy. And now we'll leave you with the brain bookmark to close today's show.
AI is a game changer. The internet changed everything. I think AI is too, by Cordt Kassner. The only thing that's consistent is change, by Cordt Kassner. Thank you, USI, for sponsoring this podcast.